I think we have a great conference today, and I think we showed the audience that we've been working very hard on a European level to show that CAM has something to offer to reduce the need of antibiotics, which is of course a very important topic in healthcare and for society. I think we already show what is there, the cooperation, the projects, the information tools. But I would like to stress that if we look at the challenges which are there, we really need to move forward, and we really need to work on, at first, more high-quality evidence of CAM treatments for infections. That's very important, to make it more acceptable. So it's about acceptability. And the second thing we have to do is that we have to work on these information tools, develop them further, like for example the fever app David Martin presented, but also the information tool which was developed in the UK about the patient information leaflets, and also what we are currently working on, an e-health application, really having all the information available for doctors, for patients, and so that it's possible to use them really well in each country in the European Union. So that's very important, and that's about increasing the accessibility of what we have. And the third thing, I think that's one of the discussions was there also, is about organizing what we are doing very well. So we heard from ZonMw, who said really organize well, make a research agenda on the European level, together with patients, with all the EU researchers who are active in these fields, but also to organize that we have a strategy, that we have programs, projects, and that we move on the short term, but also on the long term, really well organized and strategically well. JPIAMR projects actually came at a very nice time, because a couple of years ago a few people united and said, well, this antimicrobial resistance problem is really a huge problem. Can we contribute? Can we help from a CAM perspective? So in the last few years we already worked international on building a consortium, and then this JPIAMR grant application came along. And this is a network grant, so it covers only travel costs, hotel costs, conference costs, and the good thing is that it makes it possible that all kinds of researchers in the EU can come together and exchange ideas, work on projects together. So that's the main issue. It's a network grant, bringing people together, working on a theme. So the theme was CAM, what is the CAM contribution on reducing antibiotic use? So that was the main thing. And we promised to deliver an overview of what do we know about the expertise and what do we know about the evidence of CAM treatment for upper respiratory tract infections. So that's what we did. We provided a narrative review, which in a way provided all the domains which are important in this field. We provided a systematic review of systematic review, which is much more about what is really the scientific evidence there. And we collected the expertise of really different kinds of CAM experts, doctors and therapists who are prescribing these kind of remedies on a daily basis. So what do they think is important? What are the best treatments from their perspective? So that's where the expertise was collected. And the other thing the second thing we promised was to make an information tool for doctors. And we found out that there are different type of information tools. And the first one was presented, for example, by Merlin Wilcox, who showed that they've developed a patient information leaflets, which is really nice integrated in what is there already. So it adds something to what is there already. So this is one way to build an information tool which can be used by the doctor and which can be used by the patient. Other things are, for example, apps we are working on. Dave Martin presented the fever app, and we are working on also an app for all this information to be able to accessible, to be able to have access by doctors and patients in the different countries. And the third deliverable was that we said we should be able to communicate on a platform what is there. So I think we did pretty well in this area. And now it's time to move forward.